More than 2 centuries ago, somebody wrote that the duty of a physician is to cure some, relieve most, but to comfort all. Now, of course, we recognize that it's not just the physician who matters, as has been pointed out by the chair. There are so many other members of the healthcare team who matter in this regard. We're talking about nurses, we're talking about technicians, we're talking about even all the support staff that exist. But we often do not take into account that the person who is labeled as a patient is also a member of the healthcare team. They're capable of self-care. They have to ideally partner in the decision making and ensure appropriate adherence to whatever is decided mutually between the healthcare provider, the doctor, and the person who is actually labeled as the patient. And therefore, when we are talking about healthcare, not in a paternalistic fashion, but in a partnership mode, with a participatory decision making, engagement of patients, and even of their other care providers in the family becomes an absolutely essential element. And we have not yet moved adequately in that regard, because one of the things that needs to be done is to reduce the asymmetry of information and decision-making power. Healthcare has remained a very imperfect market because you have an asymmetry of decision-making where the healthcare provider has greater knowledge and greater authority to recommend what tests need to be done and what treatments needs to be taken. So we need to reduce that asymmetry of information, and fortunately now we do have the support of digital media, though sometimes that can be terribly misleading as well. All the Google searches may not necessarily be giving the best information. But it is absolutely imperative on the healthcare providers themselves to share as much information as needed and possible with the patient and the family, so that the decision making can be better informed on both sides, and it can be a participatory decision making which is in the best interest of the patient and can also ensure better adherence to whatever is being followed. And self-care is becoming more and more an important element of medical care. In fact, if you look at diabetes, after the discovery of insulin, the most powerful intervention that has emerged in the management of diabetes is self-care. And therefore, there's no reason why that can't happen for high blood pressure or many other conditions as well. So we need to ensure that these asymmetries are removed, and that is incumbent upon the doctors to do it. And of course, the nurses and others are also important partners, and very rightly pointed out by the chairperson, unfortunately. We do not have the ability to really make that possible without ensuring that we treat everybody in the healthcare team with respect. So we're to dismantle the false hierarchies that exist in the medical system, where somebody is seen as the knowledgeable caregiver and everybody else is a supplicant and a recipient. I've been told that I have just 1 minute to go, so I shall be very obediently withdrawing myself from the stage, but there are other issues regarding the healthcare system, the insurance, the financing, the delivery system, and the terrible distortions that have been brought about by the introduction of MBAs and managers who are bean counters in corporate hospitals, who actually ensure that appropriate healthcare is not provided. And certainly, if we want to set up an efficient, equitable, and empathetic healthcare system in this country, we do need a radical revision of the way the healthcare is configured, both in the public sector and the private sector. And the patient's voice will have to be heard with respect and has to play an influential role in remodeling our health system. Thank you very much.